Good afternoon. My name is Mary Ribeiro, and I am seeking a master's degree in special education. I'm here today to discuss my student Angie, who has participated in formal assessment with me, and the results of which I will identify here today. She is a 10-year-old female student who lives with her maternal grandparents, and Angie's formal diagnosis in her individualized education plan is that of intellectual disability. She also has proprioceptive issues and other mobility issues, and so she has services for speech, language, um, physical therapy, occupational therapy, and she's also in a self-contained classroom for her academic instruction. Angie's informal assessment focused in the areas of her physical um, skill sets, along with more of a concentrated focus on her language arts area with a little bit of an assessment in mathematics. Her alphabetic awareness informal assessment indicated that she is right where she needs to be with understanding the sight sound correlation. She can identify her numbers. The sound symbol correlation is spot on. And the concept of print, which is taking a book, looking at it, opening it up, and knowing what elements are what, would suggest that she has a very good handle on that as well. She knows the front cover, the back cover. She understands what illustrations are, but she was kind of confused as to what to call a photograph. Is it an illustration, or is it simply referred to as a photograph? And so that was good information for both of us. She can identify what text is versus what a number is on the page. She also knows where to find the title on both the front cover as well as inside on the title page. And she could also identify a word on the page versus a letter on the page. And she can also identify end marks and tell me what they are. In addition to that assessment, we moved into the area of rhyming, which was eye-opening for me. Angie cannot rhyme, and so we are going to spend more time on that this year. She can not rhyme, but she can identify initial sounds. She can identify medial sounds, and she can identify end sounds. She just cannot put together those word families to make them rhyme. In her writing assessment, Angie was graded on having written 3 sentences talking with me in her writing about what her favorite television show is, and I asked her to rewrite or to summarize what that episode was about. The main idea was there, the concept was there, so she was on topic. However, she struggled with forming the letters, forming the sentences, and that is not something that surprises me, having been with her for 2 years. I know we have lots of work to do there. She's coming along and developing. Once we spend more time on those word families, I believe that she will be able to build a better word and to understand that through morphemic analysis and then putting those together to create the phoneme. After we did that assessment, Angie was then asked to do some tasks in the occupational therapy and physical therapy area. I asked her to twist and stretch a rubber band, which she really struggled with. I asked her to wave while I held her wrist, and it was kind of interesting in that she would do a movement like this, not a full-on wave. And if I had not held her wrist, I think she would have stabilized her hand to do this. She struggled to bend at her elbow, not because her joints wouldn't allow her to. I think it was interesting to see that she wanted to and her body wanted her to, but that proprioceptive connection wasn't happening. So there's more work to be done there. When she was asked to walk in a straight line, she was able to do that with a nice even gait. And 6 months ago to a year ago, she wouldn't have been able to do it. So I do see progress occurring there. Twisting at the waist was not an issue. sitting down on a chair and then being asked to stand up and sit back down again. Um, she did not struggle with that, but even up to a month or two ago, she would have sort of slumped backwards after being asked to sit down and then stand up. She would have kind of stumbled backward. So I'm grateful to see that her balance is starting to improve. Um, we did some work in the speech and language area. I asked her to identify where her nose, her eyes, and so on were, and she did that without hesitation. Um, in terms of her syntax, she has a wonderful vocabulary. Um, she comprehends things very, very well and is able to make in-depth connections, much more significant than that of her, even of her age mates in general education, which tells me she's a very intuitive child. Um, she struggles to communicate them in writing, but orally, she can handle that with ease and with beauty. So that is quite impressive for a child of her age. Um, she is able to identify where her body parts are. She's able to identify her place in space and point to the wall, point to the chair, point to the roof, point to the dresser, etc. No problem. Asking her to put together a narrative with a clear beginning, middle, and end is interesting. When I asked her to tell me about her family, she told me, and I quote, "My family and I go to the zoo sometimes. They can be silly when they aren't trying to be. They tease me and play. Me, my Nana, and my Papa live in my house." It's kind of an interesting response to tell me about your family. So I like it that she sometimes thinks differently. Um, Angie's math was interesting. I had her do computation, and she could do borrowing and carrying with addition. Subtraction, she could not carry um, and borrow as you would need to do across them. Place value does complicate life for her quite significantly. Additionally, she has to say patterns out loud. So she's counting by tens. She can't just do it in her head. 10, 20, 30, 40. She gets stuck on the 9 after 90 when she's counting by tens. If you ask her to go to 120, at 90 she stumbles and goes back to the 50s or 60s almost mechanically. So we have some work to do there. She could count by twos because she was able to identify the pattern in the ones column. She noticed that it rotated through 0, 2, 4, 6, and 8. And so that was interesting as well. Um, what she struggled with as well was some logic problems. If a if the sun rises in the east at 7 a.m., when does it set? In the PM or in the AM? And so she was able to ask, what do AM and PM mean? But she still could not make the connection that the sun sets in the evening. So that was interesting. Overall, Angie has made gains according to the data that I read in her formal assessments. Um, According to her individualized education plan, she has also made some gains. And so we're going to be looking at her goals together um, with her own personal awareness, and we're going to make sure that she's working to continue to strive and exceed where she's at. Thanks.